Today I'm going to discuss about the mandible. So the mandible forms the lower jaw and it is the only mobile bone of the face, and it is the largest and strongest bone of the face. Okay, so what is the anatomical point? The horseshoe shaped body lies in a horizontal plane and the oblong rami is directed upwards. So this is the anatomical point. First of all, it contains two parts, the body and the rami. The body contains outer surface, inner surface. This is the inner surface. This is the outer surface. This is the upper border of the body, also known as the alveolar border, and this is the lower border. The upper border is marked by socket for attachment of the teeth and forming a composite variety of fibrous joint. And these are the rami. The rami contains, this is the rami. It contains four border, two surfaces and two process. This is the anterior border, this is the upper border, also known as the mandibular notch. This is the posterior border and this is the inferior border. This is the angle of the mandible. The junction between the posterior border and inferior border of the mandibular rami. This is the condylar process and this is the coronoid process. The expanded portion is the head of the mandible and this constricted portion is the neck of the mandible. Okay. First of all, let's come to the body. The external surface, in the midpoint, it contains a protuberance. This is known as the mandibular protuberance. On two sides of the protuberance, there are incisive fossa. These two are incisive fossa, depressed areas. So this incisive fossa provides the attachment of the temporalis muscle. From the external occipital protuberance, external mandibular protuberance, oblique line extends, and it continues up to the anterior border of the coronoid process. So there is a oblique line. This oblique line from before backwards, it provides the attachment of three muscles: depressor labii inferioris, depressor angulioris, and buccinator muscle. Now, see, there are two foramens at this point. These are known as the mental foramen, and it transmits the mental nerves and vessels. This mental artery is a part of the mental vessel, right? So mental artery is a branch of the inferior alveolar artery. Okay. The external surface is done. This is the inferior border. Okay, and this is the alveolar border. It is marked by socket. Okay, you can see there are two bones. This is the second and third molar teeth. Okay, they're forming the gomphosis variety of fibrous joint. There are three types of fibrous joint: suture, gomphosis, and syndesmosis. So this is a gomphosis fibrous joint. This is the internal surface of the body, and it is marked by a prominent line. This is the mylohyoid line, and it provides the attachment of the mylohyoid muscle, and it separates the internal surface into upper smooth portion. See this. This is the sublingual fossa, and the lower concave portion. Concavity is directed downwards, and this concave portion is known as the submandibular fossa. At the midpoint, there are two pairs of tubercles. These tubercles are known as the genial tubercles. The upper pair of the genial tubercles, see, these are the tubercles. The upper pair of the genial tubercles provides the attachment of the genioglossus muscle, and the lower pair of the genial tubercle provides the attachment of the geniohyoid muscle. See, there are two depressed areas, okay, fossa. These are the digastric fossa, which provides the attachment of the anterior belly of the digastric muscle, and it is supplied by the mandibular branch of the trigeminal nerve because it is derived from the mesoderm of the first pharyngeal arch, and they are supplied by the mandibular division of the trigeminal nerve. Now, see, there is a depression right here. There is a groove right here. This groove is known as the mylohyoid groove, and it transmits the mylohyoid nerves and vessels. As well as there is a foramen right here, the other side as well. This foramen transmits the inferior alveolar nerves and vessels, and there is a slight projection right here. This is the lingula. It provides the attachment of the sphenomandibular ligament. Okay, and this portion provides the attachment of the stylomandibular ligament. Okay, as well as the investing layer of the deep cervical fascia. It splits into two layers, the superficial and deep. The deep layers attach along this mylohyoid line and the superficial layer attached along this border. Okay. Now in the upper surface, along from the posterior aspect of the root of the third molar, it provides that this portion, you can see the prominence, this portion extending from the third molar teeth, posterior margin. So this portion provides the attachment of the pterygomandibular raphe. Okay, and okay, all is done. This is the raphe, this is the rami. So rami contains two processes: the coronoid process, the condylar process, superior border, anterior border, posterior border, and inferior border. This is the angle of the mandible. Now this is the lateral surface and this is the medial surface. Let me tell the attachments: the anterior border, tip of the coronoid process, and the medial surface. It provides the insertion of the temporalis muscle. The lateral surface provides the insertion of the masseter muscle. Okay, see there is a depression right here. This is known as the pterygoid fovea, and it provides the attachment of lateral pterygoid muscle. This portion of the medial surface of the rami under the mylohyoid groove, this portion provides the attachment of the medial pterygoid muscle. Okay, now the relations of salivary glands. The sublingual fossa is related to the sublingual gland. The submandibular fossa is related to the submandibular gland, and the posterior border of the rami, okay, is related to the parotid gland. Okay, now what are the ligaments that are attached to the mandible? There are mainly capsular ligament of the temporomandibular joint. Okay, then the temporomandibular ligament attached, providing attachment in the posterior border as well as the lateral surface of the rami, posterior surface and lateral surface. This is the temporomandibular ligament. The lingula, it provides the attachment of the sphenomandibular ligament. The angle, it provides the attachment of the stylomandibular ligament. Okay, the nerves that are related to the mandible. The masseter nerves and vessels pass like this. So the upper border is related to the masseteric nerve, mesenteric nerves and vessels. So mesenteric nerve. This groove, okay, the it lodges the mylohyoid nerve. Okay, and this foramen, the inferior alveolar nerve, passes through this foramen. The mental nerve transmits through the mental foramen. Okay, and the junction between the body and the rami, this portion, this is the junction between the body and the rami, extending from the root of the third molar. So it provides, there are three structures in relation to this part: the tortuous facial artery, the facial vein, and the marginal mandibular division of the facial nerve. So facial nerve, marginal mandibular division is related to this portion, and the internal surface close to the alveolar margin, it is related to the lingual nerve. Okay, and the medial surface of the rami, upper 1/3, lower 2/3, this portion is related to the first branch of the maxillary artery. Okay, it gives off the inferior alveolar artery, which then gives off the mental artery. Now we can easily determine the age of a person by looking at the mandible. In case of children and old people, the coronoid process lies higher than the condylar process. In case of, as well as, the mandibular angle is about 140 degrees in case of children and old people. In case of adults, the condylar process lies superior to the coronoid process, and the mandibular angle is 110 to 115 degrees. Now the mental foramen. In case of children, the mental foramen lies close to the inferior border. In case of adults, the mental foramen lies at the midpoint of the upper and lower border of the body. And in case of old people, due to the decay of the upper border, it is situated close to the alveolar border. So these are the ways to guess the age of a person by looking at the mandible. Now, a clinical correlation. During direct blow to the mandible, it can cause mandibular fracture, and it is often associated with dual fracture. Like often when the neck of the mandible is fractured, it is often associated with the fracture of the body at the level of the opposite canine tooth. So this is the mandibular fracture. This is all about mandible.